Assalamualaikum and good day everyone. I am Farra Norais and my partner Vicgnapriya Ramesh are going to present about our recent research study which is about modeling and simulation of queuing system for waiting time at pharmacy in healthcare center due to the current pandemic issue, COVID-19. Generally, these are all the contents that will be presented shortly. Now, I'm going to start with the abstract. During the pandemic, the pharmaceutical delivery system is redesigned in this report to reduce the waiting time for patients at the pharmacy in one of the selected healthcare centers using discrete event simulation (DES) model. Our research study has been conducted in sequential manner for getting better quality research output. From the literature review, it was found that there are several existing problems that has been studied by the current recent researchers. Therefore, the purpose of our research and the existing problems are quite same, which is to reduce the waiting time for patients in the waiting area. We have been carried the observation for two situations which are on the weekdays and the weekends. Between these two situations, we have observed that they are less crowded on the weekdays than the weekends. Now, I'm going to continue with the introduction. Based on the facts, the COVID-19 pandemic is Malaysia's deadliest infectious illness outbreak since the 1918 Spanish flu, which has killed 34,644 people, or 1% of the country's population. Pharmacy services have a critical role in public health in preventing and containing the COVID-19 pandemic during an emergency or crisis such as this one. Pharmacists all over the world, particularly in developed countries, have responded quickly and intelligently to public health concerns, such as establishing professional, protective, and service guidance for pharmacy staff. So in this study, we shall monitor the precise circumstances at a pharmacy in one of the healthcare facilities, which is in Hospital Seberang Jaya in Penang, Malaysia. Problem statement. The COVID-19 pandemic has had a devastating impact on healthcare centers, especially the flow system that have been used. Therefore, a study is needed to reduce the waiting time for all patients in Hospital Seberang Jaya's pharmacy by using the discrete event simulation model. So here is our research question. The first one is, what is the main purpose of the study? The second one is, what is the impact of discrete event simulation model in this study? And the last one is, why do we need the discrete event simulation system in the pharmacy to sort out the current patient's waiting time? In order to answer the research question, we have come up with three research objectives. The first one is to develop discrete event simulation model to improve the waiting time in the pharmacy department. The second one is to reduce patients' waiting time in the pharmacy. And the last one is to determine the best model for the system in pharmacy due to the current pandemic situation. As for our scope of research, we have divided them into 5 sections. The first section is purpose. The purpose of this study is to help the healthcare center improve their patients' flow system due to the pandemic of COVID-19 situation by using discrete event simulation method. The second section is data collection. Data collection will be made by using observation method. The third section is the location of study. Our study has been carried out in pharmacy department at Hospital Seberang Jaya in Pulau Pinang. The fourth section is observation. The observation will be taken starting from the pharmacy entrance door until the exit door. Finally, the last section, which is estimated duration of data collection. The data collection session probably have taken 2 days to be fully completed. Now, I'm going to continue with the literature review. Discrete event simulation has become a popular and successful decision-making tool for maximizing patient flow, lowering healthcare costs, and boosting patient happiness by allocating scarce healthcare resources optimally. We can acquire high-quality solutions in seconds in this study. as opposed to manually generated timetables, which require a long time and effort. In this study, emergency department was taken as an example because usually in hospital, emergency department and pharmacy department will be crowded with many patients. The term of emergency department overcrowding refers to a situation in which the demand for emergency services exceeds an emergency department's ability to offer adequate care in a timely manner. Previous studies indicate that one of the main factors causing emergency department overcrowding is inefficiency of the emergency department process. By implementing a simulation model in the emergency department, Garcia were able to minimize patient wait times, while Brailsford also employed simulation modeling to assess accident and emergency departments in Nottingham, England, a key component of the whole conceptual map model.
Next, we continue with model development. First of all, we'll continue with description of the case study or problem articulation. The pharmacy department is one of the well-known hospitals in Penang, which is Hospital Seberang has become the way of society because of their slow system operation. According to our observation, the flow of patients from the registration department to the pharmacy is extremely slow. So we have decided to create several assumptions of model simulation to overcome this problem, which is to reduce the waiting time for the patient. Next, we'll continue with assumption of the simulation or dynamic hypothesis. To reduce the waiting time, we have prepared two different assumptions. The first one, we have decided to add one more extra counter as an express lane. It is assigned as counter 2. This express lane was assumed to give priority to the chronically ill, pregnant mothers, and the elderly, while the current counter will only serve patients that are not from those groups. Therefore, the second assumption of simulation model has been designed with additional two extra counters, so there will be three counters altogether. The purpose of the additional two counter is to assist in handling the crowded situation at the pharmacy. The first additional counter is the express lane for those who have the priority, and the second counter is for those who have submitted the receipt of doctor from wards and already has the pharmacy's prescriptions. Besides, the proposed model and its elements or stocks and flow diagram will be continued. To achieve the research objectives, we will use discrete event simulation (DES) method, predict and experiment and intervention on actual situation. DES is the method to simulate the complex system and the interaction between objects and environment. There are some of the elements have been characterized in this study, which is entities. Entities are the patients, system state queue lanes, time taken spent for each patient in the pharmacy, which is the simulation clock, 7 days in 1 week has been the event list. Arena Simulation Software Output Analyzer is the system we have used to collect data, to record history, and to analyze in the research. The current system used by the pharmacy is the initialization routine that have been used. The timing routine was 9 hours, which is 8 a.m. to 5 p.m. Event routine is the subroutine for each different type of event that specify the actions. And finally, report generator. We have been used Simon summary reports that aggregate results as obtained from the statistical counters, which will be used in the result and also conclusion. This is the model development we have been used. So it will start with it is the current system flowchart in the pharmacy in Hospital Seberang Jaya. Based on the figure 1, the current system flowchart is the pharmacy seems to be normal and fine. But the actual situation in the pharmacy is very crowded with the patients who must wait for their queue number to be called. So we have decided to add additional express lane for those who have priorities such as patients with chronic disease, pregnant ladies, senior citizens to the scenario model, and will compare the results in the current system result in the future. Next is data collection or distributing fitting. The collected data was analyzed through the input analyzer in Arena software. There are three inputs variables, which are arrival time, service time, and departure time. We define our random output variables as maximum and average time in system, the number of patients served, and maximum number of patients in waiting time in process. We found out that the arrival time for patients enter the pharmacy on weekdays follows the distribution of long normal, and secondly, the service time for patients on the weekdays follows the long normal distribution too, which are shown in the figures that have been attached to the slide. Nevertheless, the departure time for patients on the weekends also follow the distribution of beta, which are shown in the slide 2. Apart from that, we'll continue with verification and validation of the model or structure and behavior. For verification and validation purposes, the model was simulated 3 times, which are 3 replications. Based on the results, we verified that the process step is similar between model and real system. Compiler in program was used to check that program run whether correctly or not. This was known that there is no error while program execution. To know the validity of our model, we compare it with the performance of real system. Since the validity level of our model is in between plus minus 10%, we can conclude that our model is valid. So this is the analysis of basic simulation model, and it is the actual simulation model. So our entities are patients who entered the system of pharmacy department. In this figure, we showed that simulation model developed during our study by using Arena simulation software. Based on the flow, we can observe that once the patient arrives, they will need to take number turn. Next, the patients will move to the waiting area and wait for their number to be called by the pharmacist. Once their number announced, they will go direct to the only one counter, which is labeled as counter 1. Finally, after they are being served at pharmacies at counter 1, they will depart the pharmacy. So next, these are the scenario or intervention 1 and 2. So based on figure 15, scenario 1, we have added another counter, which is counter 2. Counter 2 is for those who only have the priority, like pregnant ladies, patients with chronic diseases, and senior citizens. This additional counter will automatically assist the system to be more effective so that the waiting time for patients will be reduced. As for the figure 2, which is the scenario 2, we have added another counter from the previous scenario, which is also known as intervention 1, which is scenario 1. The additional counter is labeled as counter 3. Counter 3 is a just pickup counter, which patients can just give their prescriptions from the doctor in the hospital wards, will not have to wait for a long time. They also will be given priority to just move passing through the waiting area and don't have to wait for their number to be called, because they can directly go to counter 3 to pick up their medicines. So the most important part, which is result and discussion. The objective for this study is to improve waiting time towards service provided in pharmacy by reducing the time spent by the customer in queue. So this is the table 1 that shows the measures with three replications. From the result we have drawn few findings which are useful. Firstly, the queuing system on weekdays and weekends in an encounter has an average queue length of 0.06212 and 0.71161 minutes respectively, which is equal to 3.7272 and 42.6966 seconds respectively as well. Besides, the maximum number of customers in queue is approximately 12 people. With this high number of customers in the queue, we suggested that there might be bottleneck effect. Long waiting time and numbers of customers waiting in queue might affect the patients. Waiting time to get the services in the pharmacies also. Hence, we are going to carry out few experiments in finding an effective way to handle the long queue in system to improve customer satisfaction. With high number of waiting, improvement of service and waiting time might not met may result in service of the pharmacy as customers tend to get tired of waiting for a long time, which may lead them to get sick of it. So from the table 1, we notice that the maximum waiting time is in the queue for for pharmacy counter is 1.17852 and 4.5372 minutes on weekend and weekdays respectively. Hence, a pharmacy counter has larger maximum waiting time in queue and it will cause bottleneck as well, which is resulted from the weekend service counter that is 50.65% only. For the payment counter on weekdays are very busy as well, which will cause the bottleneck in the system as well. Finally, as for the conclusion and recommendation, the study has employed the discrete event simulation approach in modeling the queuing system in hospital's Branch pharmacy. Currently, there is only one counter as the pharmacy, and they are having problem of waiting in the queue when patients must have to get their service as well. The study has helped the management in finding solution by developing a simulation model that later could be useful in carry out what if analysis to reduce the waiting time in queue. Originally, there was only one counter, which will be operated from 8 a.m. to 5 p.m. daily. Based on what if analysis, the study proposes a solution of introducing three counters, which can make the process easier when different patients have different services that should be done without waiting time for a long time. This alternative would be significantly reducing the number of waiting time in the queue, which may improve the patient services and also it will cause the customer satisfaction to be fulfilled, and it will cause the pharmacies to get uh, more improved services as well. Thank you.